What steps follow an HSIL diagnosis from a Pap smear? Discovering high-grade squamous intraepithelial lesion from a Pap smear can feel overwhelming, but understanding the next steps can help you feel more in control. When a Pap smear shows HSIL, it means there are abnormal cells that could develop into cervical cancer if not addressed. The first step usually involves a procedure called a colposcopy. During this exam, a healthcare provider uses a special microscope to look closely at your cervix for any abnormal growths. Often, a biopsy is taken during the colposcopy, which involves removing a small tissue sample to confirm the diagnosis and see how severe the abnormality is. If you haven't had recent testing for human papillomavirus, your doctor might recommend HPV testing at this stage. This test checks for high-risk HPV types like HPV 16 and 18, which are linked to a higher chance of developing cervical cancer. Knowing your HPV status helps guide the next steps in your care. For women aged 25 or older with HSIL and a positive HPV test for HPV 16, some doctors might suggest moving directly to treatment without waiting for biopsy results. This approach is called expedited treatment and is based on the higher risk of significant precancerous changes. The most common treatment in this case is a loop electrosurgical excision procedure, or LEEP, which removes the abnormal tissue from the cervix. It's both diagnostic and therapeutic, helping to eliminate the abnormal cells and prevent progression. If your healthcare provider recommends a biopsy first, the tissue sample will be examined to determine if there is cervical intraepithelial neoplasia grade 2 or grade 3, which are more serious precancerous conditions. If confirmed, treatment options like LEEP are typically advised. Sometimes, if the lesion appears less severe or if the patient prefers to avoid immediate treatment, close monitoring might be suggested. This involves regular follow-up visits with repeat Pap smears and HPV testing to watch for any changes. Treatment options mainly include LEEP, which involves removing the abnormal tissue with a small wire loop, and in some cases, a cone biopsy might be performed. A cone biopsy removes a larger tissue sample and is usually reserved for cases where the extent of abnormality is unclear or if previous tests were inconclusive. After treatment, ongoing follow-up is essential. Your doctor will likely recommend repeat Pap smears and HPV testing at regular intervals to ensure the abnormal cells do not come back. Deciding between treatment and surveillance depends on your individual risk factors, age, and screening history. It's important to work closely with your healthcare provider to develop a plan tailored to your needs. Managing HSIL early and effectively is key to preventing it from progressing to cervical cancer, which makes timely follow-up and treatment crucial. Always remember, each person's situation is unique, and your healthcare team is there to guide you through the best options for your reproductive health and overall well-being.